Here's a CT that was performed of the abdomen and pelvis. The dominant abnormality seen on this particular imaging study are these striated nephrograms bilaterally. You can see normally when you have this phase of contrast, this is a nephrographic phase in which the contrast is evenly distributed throughout the kidney. You can actually see that there are areas, these kind of wedge-shaped or striated areas, in which you don't see great uptake of contrast. And this is not only involving the left kidney, but you can also see in the right kidney as well similar imaging features. Now, the top differential diagnosis for this is pyelonephritis. So you'd want to get a urinalysis. You could see whether there's urethral thickening of the ureters. In this case, it doesn't look thickened. You can go down to the bladder and see maybe if there's gas within there. Those are imaging features that may suggest pyelonephritis. The other thing you can look at as well is perinephric stranding. Oftentimes, if you have pyelonephritis, you're going to see some stranding around the kidneys. In this case, you don't see that there. And the urinalysis in this particular patient was negative. Other things that can cause a striated nephrogram that we have to think about are acute tubular injury, sometimes leukemic infiltration or lymphomatous infiltration of the kidneys can give this appearance. But the other thing to think about is systemic hypotension, embolic disease, and intrarenal vasculitis. Now, as far as systemic hypotension, you can see that the IVC looks fairly plump here, so it doesn't appear that that's what's going on. But this patient actually had a recent history of cocaine use. And so cocaine is, its mechanism of action is a blockade of serotonin, norepinephrine, and dopamine reuptake, which can lead to widespread vasoconstriction, including in the renal vasculature. And so this is one of the things that can actually give this abnormal appearance of the kidneys. This patient did actually have an elevated serum creatinine level and had acute renal dysfunction, which actually normalized after cessation of the cocaine and hydration support and blood pressure support. And this patient became asymptomatic afterwards. So the way to diagnose this is the gold standard is going to be a biopsy to see whether there's cocaine-induced injury to the kidney. But in this particular case, it had resolved clinically, and so a biopsy was not performed.